A 71-year-old man in Ohio went to his doctor last year for a routine visit. His doctor handed him a printed list and said, "These are all the tests your Medicare covers at zero cost this year." He counted 11 of them. He had used exactly one. The others, a colonoscopy, a heart screening, a lung cancer scan, a bone density test, and more. He had been skipping for years, not because he didn't care about his health, but because he assumed he couldn't afford them. He was wrong. And the hard truth is, most seniors are in the exact same situation right now. Medicare covers over 24 preventive screenings at absolutely no cost to you. No copay, no deductible, no bill in the mail. But the system doesn't call you. It doesn't send reminders. It doesn't explain what you're entitled to. So today, we're going to fix that. Here are 11 medical tests Medicare covers 100% free. Tests that could literally save your life, that most seniors are quietly skipping every single year. Let's get into it. Number 1, colonoscopy. Worth up to $4,000. Let's start with the big one. A colonoscopy without insurance costs between $1,250 and $4,800. The national average sits around $2,750. That is real money. And for millions of seniors on a fixed income, that price tag is exactly why they keep putting it off, year after year. Here's what most people don't know. Under the Affordable Care Act, Medicare is required by federal law to cover colonoscopies at 100%. No copay, no deductible, $0 out of your pocket. If you are 45 or older and enrolled in Medicare, you are entitled to a free screening colonoscopy once every 10 years. And here's a detail that trips a lot of people up. If your doctor finds and removes a polyp during the procedure, it's still covered as a free screening under most. You don't get a surprise bill because they found something. Colon cancer is one of the most preventable cancers we know of. Caught early, the survival rate is over 90%. Caught late, the odds flip completely. If you've been skipping this one because you thought you couldn't afford it, you can. You always could. Schedule it this week. Number 2, lung cancer, CT scan, up to $1,500. Lung cancer kills more Americans every year than breast, prostate, and colon cancer combined. And for decades, there was no reliable way to screen for it early, until low-dose CT scans changed everything. Medicare covers this scan completely free, once per year, if you meet the criteria. You're between 50 and 77 years old. You're a current smoker, or you quit within the last 15 years. You've smoked the equivalent of 1 pack a day for at least 20 years. Without insurance, this scan runs anywhere from $200 to $1,500, depending on where you go. With Medicare, it's $0. If you smoked and you stopped, or if you're still smoking, this scan could find a tumor while it is still the size of a pea. When surgery is simple and survival rates are high, this is not a test to skip. Number 3, mammogram. Up to $400. Every woman enrolled in Medicare is entitled to one free mammogram every 12 months. No deductible, no copay, no cost whatsoever. As long as your provider accepts Medicare assignment, which most do. Without insurance, a mammogram costs between $100 and $400. Breast cancer affects 1 in 8 American women over the course of their lifetime. And like most cancers, catching it early is the difference between a manageable diagnosis and a devastating one. Here's the thing about mammograms. Most women say the anxiety of scheduling one is worse than the test itself. It takes less than 20 minutes. It is covered. There is no reason to wait. If you haven't had one this year, call your doctor today. Number 4, bone density scan, DEXA scan. Up to $300. Every year, 1.5 million Americans suffer a bone fracture caused by osteoporosis. Many of these fractures, especially hip fractures, are life-changing. Some are fatal. The scary part? Most people have no idea their bones are weakening until something breaks. A bone density scan, also called a DEXA scan, measures the strength of your bones before anything goes wrong. It takes about 10 minutes and is completely painless. Medicare covers it free once every 24 months for women who qualify, and more frequently if your doctor determines you're at higher risk. Without insurance, this test costs $150 to $300. If you are a woman over 65, this test should already be on your schedule. If it's not, that's a conversation worth having with your doctor at your next visit. Number 5. Cardiovascular disease screening, up to $200. Heart disease is the #1 killer of Americans over 65. Not cancer, not strokes, heart disease. Medicare covers a cardiovascular disease screening blood test once every 5 years. This test checks your cholesterol, lipid levels, and other markers that indicate how hard your heart is working and whether trouble is building. Without insurance, these blood panels run $100 to $200. With Medicare, free. Here's why this matters. High cholesterol and dangerous lipid levels almost never cause symptoms until they cause a heart attack. The only way to know is to test. If you haven't had this panel in the last 5 years, ask your doctor to order it at your next appointment. It's already paid for. Number 6, diabetes screening, up to $150. Over 37 million Americans have diabetes. Another 96 million have prediabetes, and most of them don't know it. Uncontrolled diabetes damages your kidneys, your eyes, your nerves, and dramatically raises your risk of heart disease and stroke. Medicare covers free diabetes screenings, up to 2 per year. If you have any of the following risk factors: high blood pressure, a history of abnormal cholesterol, obesity, or a family history of diabetes. And here's the sobering reality. If you are over 60, have high blood pressure, and carry any extra weight, you almost certainly qualify for this free test right now. Without insurance, a fasting glucose test or A1C panel runs $50 to $150. With Medicare, $0. The test takes 5 minutes and a single blood draw. If it catches prediabetes early, lifestyle changes alone can stop it from ever becoming full diabetes. That's thousands of dollars in medications and complications avoided. Number 7, depression screening, free once per year. This one surprises people. Might be one of the most important on this list. Retirees are 40% more likely to be diagnosed with clinical depression than working adults. The transition out of a career, the loss of friends and family members, health challenges, isolation. It adds up in ways that aren't always visible from the outside. Medicare covers a free depression screening once every 12 months. Depression is not a weakness. It is a medical condition, and just like high cholesterol or diabetes, catching it early leads to far better outcomes. If you have been feeling persistently low, uninterested in things you used to enjoy, or more isolated than usual, bring it up at your next appointment. This screening is free, it's private, and it could be the most important conversation you have all year. Number 8, abdominal aortic aneurysm, ultrasound, up to $500. This one is exclusively for men, and most men have never even heard of it. An abdominal aortic aneurysm is a bulge in the large artery that carries blood from your heart to the rest of your body. It has no symptoms. You won't feel it. You won't know it's there until it ruptures, at which point Medicare covers a one-time free ultrasound to screen for this condition if you are a man between 65 and 75 who has smoked at least 100 cigarettes in your lifetime. Without insurance, this ultrasound runs $200 to $500. If you're a man in that age range with a history of smoking and you've never had this test, this is your reminder. It's free, it's painless, and it could save your life with a single 30-minute scan. Number 9, glaucoma test, up to $100. Glaucoma is called the silent thief of sight because by the time most people notice vision changes, significant damage has already been done. Over 3 million Americans have glaucoma. Half of them don't know it. Medicare covers a free annual considered high risk, those with diabetes, a family history of glaucoma, African Americans over 50, and Hispanic Americans over 65. Without insurance, this test runs $50 to $100. This is a quick, painless exam your eye doctor performs with a small puff of air. It takes 30 seconds, and it is the only way to catch this condition before irreversible vision loss sets in. If you fall into any of those high-risk categories, this should be an annual appointment on your calendar. Number 10. Cervical cancer screening, Pap smear plus HPV test, up to $200. Many women over 65 assume they no longer need Pap smears. That assumption can be dangerous. Medicare covers cervical cancer with a Pap test and a pelvic exam once every 24 months for all female Medicare beneficiaries. And for women considered high risk, coverage extends to once every 12 months. Without insurance, these screenings cost $100 to $200. With Medicare, $0. Cervical cancer is almost entirely preventable when caught early. The screenings take minutes. They are free. And skipping them based on age alone is a mistake your future self cannot afford. Number 11. Annual wellness visit, priceless. This last one is not a test, it is a conversation. And it might be the most valuable free benefit Medicare offers. Once per year, Medicare covers a full annual wellness visit with your doctor at absolutely no cost, no copay, no deductible. During this visit, your doctor reviews your complete health history, updates your medication list, assesses your risk for future health problems, and, this is the key part, creates a personalized prevention plan just for you. That plan tells you exactly which free screenings you qualify for. Think of it as your roadmap to every benefit on this list, customized for your age, your risk factors, and without a wellness visit, most seniors have no idea which of these free tests they actually qualify for. With it, you walk out of the office with a schedule, a plan, and a clear picture of your health. If you've never had one, or if it's been more than a year, call your doctor's office tomorrow morning and ask to schedule your free annual wellness visit. That one phone call could and potentially catch something that saves your life. So there you have it. 11 tests, thousands of dollars in value. Your cost, $0. A colonoscopy, a lung CT scan, a mammogram, a bone density test, a heart screening, a diabetes check, a depression screening, an aortic aneurysm ultrasound. These aren't hidden in fine print or locked behind special programs. They are already part of your Medicare. They are already paid for. The only thing standing between you and these benefits is a phone call to your doctor. Make that call. This channel is here to help you hold onto your health and your money. Because you've worked too hard and too long to leave either one on the table. If this video helped you, share it with someone you care about. They may be skipping one of these tests right now without knowing it's free. And hit subscribe, because we put out tips like these every single week. We'll see you in the next one. Total estimated value of screenings covered, $2,000 to $8,000, plus per year depending on which tests apply to you.